I'm Dr. Jennifer Hawasley. I'm a breast specialist at LMH Health. So as a breast specialist, I focus a lot of my time on breast cancer, taking care of breast cancer patients from the start of their diagnosis through their breast cancer surgery, along with helping coordinate their other treatment options such as chemotherapy, radiation oncology, and anti-hormone therapy with the other doctors that are part of the team. When I talk about goals of care with a patient, we really focus on evidence-based medicine. So breast cancer occurs in 1 out of 8 women in this country. So it means that we have a lot of good studies and data to help show what works and doesn't work in specific situations. So although every patient is unique and every cancer is unique to that patient, there's lots of patients with similar situations before them that can help show us what the best pathway is likely for that patient. My philosophy of care is truly trying to give the patient power over their diagnosis. Today, because breast cancer is caught so early, most people have very good outcomes, but there's still a lot of options as to how we should treat the breast cancer. And I want the patient to be making those decisions with information about the disease process. And so when they walk away from that first clinic visit, I want them to know about the disease, how we treat it, and outcomes from those treatments. I focus most of my practice on breast cancer. However, I also see patients with benign breast disease. So people that are higher risk of breast cancer, people with a family history or abnormal biopsies previously, to keep a close eye on them to make sure if they get a cancer, we catch it when it's still very early and very treatable. Also see people with breast pain, nipple discharge, lumps and bumps, and help get those worked up and so that they can still get resolution of those problems. LMH Health is offering a very comprehensive cancer treatment plan for women with breast cancer. So in addition to breast surgery, plastic surgery, medical oncology, and radiation oncology, it also has genetic testing available and all of the other resources that a patient needs to get through a diagnosis and be successful. Coming into a breast specialist's office, especially if you end up having a diagnosis of cancer, can be very anxiety-producing. By giving patients information about the disease itself and how we treat the disease, and then the outcomes of those treatments, I think gives people the power over the disease, so when they leave, they're a lot less anxious.